Type 2 diabetes is the most common form of the disease. It's important to talk with your doctor about your health and decide the best way to manage your diabetes. In today's Your Community Health, WENY's Renata Steele talks with a doctor from Arnott Health about type 2 diabetes.
Hello and welcome to this edition of Your Community Health. I'm Renata Steele with WENY News, and I am talking with Dr. Amit Sharma, who is a family medicine doctor here in Elmira at Arnott Health. This week we are talking about diabetes. Now, a lot of people have diabetes, or someone in their family, they know someone who does. And that's what we want to talk about today, Dr. Sharma. So thank you for offering your expertise on this topic. And one of the first questions I have for you are, what are some of the risk factors for diabetes?
So thank you again. So diabetes is, sometimes we call it diabetes. It can also be referred to diabetes mellitus type 2, so which means having too much sugar in the blood. Mm-hmm. And this can affect the body in many ways. The body is unable to use the sugar. So some of the risk factors are, if you have high blood pressure, if you have high cholesterol, and being overweight are some of the few risk factors for diabetes.
Okay, and now what are some of the symptoms? What should people look out for in themselves that they say, something's not right here, I think I need to see a doctor?
So the diabetes, most of the time people don't have symptoms. So if you do have symptoms, it's important to know what they are. Mm-hmm. And this can include the ability to need to urinate more often, intense thirst, sometimes blurry vision, losing weight. Those are few of the symptoms, but majority of the time people don't have any symptoms.
Oh, that's really interesting. And now, say you get a diagnosis of type 2 diabetes, what are some of the treatment options for you?
So there are many treatment options. First, initially, depending on how your diabetes is, what stage it is at. So we start with lifestyle modifications. And I am going to use three things to sort of, help with this. ABCs of diabetes. A is A1C. So this is measuring your average sugar over 3 months.
Okay.
B is controlling the blood pressure. So controlling the blood pressure helps with the diabetes. And C is cholesterol, having too much fat in the blood. If we control that, helps diabetes too.
I see. And now for someone who has this form of diabetes, what are some of the complications of having this disease?
Sure. So diabetes affects the whole body, and it can have serious complications such as heart problems, heart attacks. It can cause strokes. You can have kidney disease, affects your vision, and it can lead to blindness in some cases. Wow. Sometimes it can cause you to lose parts of your hands or feet or some other body part. And you can have a lot of pain and loss of feeling with diabetes too.
I see. So it's very important to see your doctor, have a management plan for type 2 diabetes.
Yes, absolutely.
All right. Well, Dr. Sharma, thank you so much for that valuable information. And you can find more on our website, WENY.com. Thank you for joining us for this week's Your Community Health.